my dear students, I welcome you all in my surgery online class, and today topic of discussion is hydatid cyst. So hydatid cyst is a structure containing the larval stage of the tapeworm known as Echinocus granulose. So this structure is formed inside the liver. It contains the larval stage of the parasite or the hookworm known as Echinocus granulose. Echinococcus granulosus. Echinococcus granulosus. So it is a hookworm, and this hookworm is present in host. The chief hosts are dogs, wolf, and foxes, and the intermediate host. This is the chief host, and the intermediate host is sheep, and accidental intermediate host is man. So if the Echinococcus granulose eggs get ingested into the dogs, or the worm get ingested into the dog, that will release the worms, and worms will get excreted in the dog's feces. So it will get exceeds in the dog feces, and if the human is handling or cuddling the dogs, or if come in contact with the skin of the dog or fur of the dog, which are contaminated with the eggs of this hookworm Echinococcus granulose, then these eggs will enter into the man. So the chief host is dogs and wolves and foxes, and the intermediate host is sheep, but the accidental intermediate host is man. So what happens when man consumes, or when the contaminated food gets ingested, or the contaminated water? So if the man consumes contaminated food or water that are contaminated with the eggs of Echinococcus granulosus. So that's how the entry occurs of this tapeworm. So this eggs will enter into the mouth, then man will consume the contaminated food or water. Through that, this eggs will enter into the mouth of the human. Now from mouth it will enter into the stomach, and through stomach, duodenum. In duodenum, because that contains acids and lot of pancreatic juices needed for the digestion. So the process of digestion needs lot of acids and pancreatic juices. So because of that juices and that acids, this egg will get hatched. Egg hatches. Because the juices will dissolve the shell of the eggs, and the eggs will get hatched, and then embryo will come out. So the embryo is known as hexacanth embryo. This is a particular name given to this embryo, hexacanth embryo, because this embryo, it is not a complete, that the complete structure of the Echinococcus granulosus, it has a body, but the hexacanth embryo has coles and hooklets. So it has two pairs of hooklets, this hexagon embroid. Then this will penetrate into the mucosa of intestine, and from there it will move into the portal circulation, and via portal vein. So via portal vein it will enter into the liver. This echinococcus granulosus can enter into the brain also, into the heart, into the bones, into the kidney. It can travel to the different organs, but mostly in 70 to 80%, this echinococcus granulosus grows and stays inside the liver and forms hydatid cyst. The larval stage of the echinococcus granulosus grows or stays inside the liver. So, because liver has lot of nutrition for echinococcus to grow and multiply. Liver provides lot of nutrition to this tapeworm. So that's why tapeworm usually grows here. In 70 to 80%, it grows here and get multiply and form hydatid cyst. So the human consumes the contaminated food and water, and then this eggs of the echinococcus granulococcus enters into the stomach and duodenum, and then these eggs get hatched because of the acids and pancreatic juices, and when the eggs will get hatched, the embryo comes out, the hexagon embryo, because it contains hooklets, and then it will penetrate the mucosa of the intestine. From there it will move via the portal vein into the portal circulation and into the liver, and there it forms hydatid cyst. Now the pathology, how the hydatid cyst is formed. See, this is the liver. So in liver it enters this egg is got hatched in duodenum, and now the hexagon embryo has released and it will reach into the liver, and there it will produce germinal cells, and that cells will grow and multiply. So these cells will multiply, these germinal cells will multiply. So there will be formation of cluster of the cells. Now what happens when this cluster is formed, then this will get organized in the surrounding. So after the cluster formation, the cells will organize in the surroundings and form a layer, a germinal layer is formed. Germinal layer is formed. It is very thin layer, and this layer is known as the ectocyst. Now it will release the fluid inside. So the fluid is released. This fluid is hydatid fluid. So this germinal layer will secrete hydatid fluid inside and will form an outer layer or cyst outside. This is the ectocyst. Sorry, this is formed later. अभी germinal layer ही है. Germ cells have formed the clusters, and after afterwards they will surround outside and will form a germinal layer. This layer is known as endocyst. This germinal layer is known as endocyst. Now what happens? It will secrete the hydatid fluid inside. Hydatid fluid is secreted inside. Now this will keep growing on. This germinal cells will keep growing on. So this will keep growing on. Now what will happen? This will keep growing on. So the size of the liver will also get increased. So there will be hepatomegaly. In clinical features you will notice hepatomegaly. Liver with increased size, with round borders and smooth surface. So liver will get increased. And the endocyst is formed. This is the germinal layer, also known as the endocyst. Now what? This cells will keep continuing growing and growing. They cannot be, this larva, the worm is in larval stage. It is not grown up properly into the embryo, and it could not be into the proper shape of embryo because that environment is not in favor. But it will keep going on, and multiplication of this germinal cells will keep continuing. So what will happen next? The germinal layer is formed, and now the cells will keep growing on. Now this will cause what? Increase of the size of the liver, and because the liver will get increased, and this will compress the tissue of the liver as this cyst is growing on. Cyst is growing on, so that will compress the surrounding tissues and structures. The veins present or the canals, the liver canculi are present. There are different veins. So this cyst will compress the structures and the tissue of the liver. Now what will happen? In reaction to that compression of the cyst to the tissue of the liver will do what? Liver in reaction will produce a layer. So a layer is formed outside. A layer is formed outside, a thick layer, thick fibrous layer. So this is the endocyst, the germinal layer of the, I am making with a different color so you will easily recognize. So this red one is, this is the very thin, this is very thin layer, germinal layer composed of germinal cells. It is produced by the Echinococcus granulosus embryo. That embryo is known as hexagon embryo. That embryo has formed this germinal layer, and this layer is known as endocyst. Now because it is causing compression to the liver tissue and the structures surrounding, so in that reaction liver has formed another layer. This layer is pericyst. Pericyst or pseudocyst, also known as by the name of advential layer of liver. Advential layer of liver. So this layer is formed by the liver in reaction to this Echinococcus granulosus. This is very thick layer and it is fibrous layer. This layer is fibrous and it is composed of eosinophils, mononuclear cells, giant cells, fibroblast. So this fibrous thick layer is the endocyst. Now what happened? But the cells will keep continuing growing. So the cells will keep continuing growing. Now because this has limited space, it cannot now grow more because there is compression produced by the liver now. So liver has produced a pericyst. This is the pericyst produced by the liver. So now the cyst, this endocyst, this is the actual layer of the hydatid cyst. It cannot grow bigger because there is compression pressure of this pericyst, the layer produced by the liver, or the pseudocyst, also known as pseudocyst. So now what? The cells will keep continuing growing inside this area only. Now what will happen when this cells will keep grow? This will form clusters. So clusters will be formed. Now after that, this will form further the cyst wall outside. And because it cannot grow further, so the endocyst will release hydatid fluid inside this, and outside it will release ectocyst. So the ectocyst will form here. Now the ectocyst will form here. This is blue is ectocyst. Outside. This ectocyst is laminated or laminated layer or laminar layer. This ectocyst is a laminar layer. It is elastic and white in color. Like we have seen the eggs. So eggs have a white layer outside, so it will resemble like the eggshell, but not hard. It is elastic and white, laminar layer, this ectocyst. So endocyst will do what? It will release the hydatid fluid inside and will form the ectocyst, the laminar layer, that is the elastic and white layer outside. So there are three layers. Pericyst, that is the outer layer, that is formed by the liver in reaction to the parasite, in reaction to the larval stage, that is the hexacanth embryo. So the liver has produced the pericyst, a thick fibrous tissue layer composed of fibroblast, mononuclear cells and eosinophils and giant cells. And the second layer is ectocyst. Second layer is ectocyst, which is formed by the endocyst, and the endocyst is the innermost layer, very thin layer, that is I have made in red. It is the very thin layer. Now always remember, this pericyst produced by the liver, or known as the advential layer of the liver, it is adherent to the liver tissue. So while the surgical procedure, when this will get peeled off, that will result in bleeding, because this is adherent to the liver. This black thick layer is pericyst. Inside this blue is ectocyst, and inside this red one is endocyst, a very thin layer. This is the germinal layer, thin and germinal layer. Now what will happen, this germinal layer will invaginate inside and will produce what? Brood capsules. These are brood capsules. I will draw in the large area. So the outermost layer is, this is the thick fibrous layer produced from the liver in reaction to the hexagon embryo. So this is the thick fibrous tissue layer, because there has too much compression to the liver, so that's why in reaction liver has produced this layer to avoid further compression of the structures. So this is the actocyst. This is the pericyst. The outermost layer produced from the liver. Inside it has a germinal layer. This is the very thick layer, very thin layer known as germinal layer, endocyst. The innermost layer. It has produced the laminar layer. So this is C. So the outermost layer is the pericyst, composed of fibrous tissue and eosinophils, mononuclears and giant cells produced by the liver in reaction to the hexagon embryo. Then the innermost layer is the endocyst. This is the germinal layer, the innermost layer. I will draw in sequence. The outermost layer is pericyst produced from the layer. Then the second is actocyst produced by the endocyst. This actocyst layer is produced by the endocyst layer, and this innermost, that red line that I have drawn with the red color, it is the endocyst. The innermost layer, also known as the germinal layer, the innermost layer, it is very thin, and outer this endocyst has formed actocyst, that is the white and elastic layer, and outer this there is pericyst. So there are 3 layers. So this hydatid cyst is composed of 3 layers. Now this is the hydatid cyst, and further the multiplication of germ cells is going on. So the germ cells are growing on. So they will form clusters and they will further form the wall outside. So they will form the clusters. These germinal cells will form clusters, and then they will form the wall outside. They will form the cystic wall outside. So see, these are the brood capsules. These brood capsules are the cystic walls produced by the invagination of the germinal layer. This endocyst will move inside, will invaginate into the cyst and will form the brood capsules. These brood capsules are attached with this layer with the stalk. This is stalk. So these brood capsules are attached with the stalk, and this brood capsule capsules contain the scoliosis. Scoliosis. That is the scoliosis in larval stage. Now this will keep continuing, so the cyst will keep continuing. Now these are the sterile cyst. Now that's how this is the mother cyst. This big one is, this is the mother cyst, and these are the daughter cyst, and these are the granddaughter cyst, and that's how the cyst will keep growing. These are the granddaughter cyst. So that's how the multiplication of the germ cells will keep growing on, and that multiplication will cause the cluster of the cells. This will form a cystic wall outside. So inside the cyst there is cyst. So inside the mother cyst there are lot of granddaughters and daughter cysts. Daughters cyst. Now there is fluid inside this cyst. This fluid is hydatid cyst, and the fluid is inside this also. In this daughter cyst, in this granddaughter cyst, there is fluid inside this cyst also. This fluid is clear, acidic, or could be pale yellow. And this hydatid fluid has a hydatid sand. Granules. The granules are called hydatid sand. So this is the structure of the hydatid cyst. A mother cyst will have daughter cyst, granddaughter cyst, and granddaughter cyst, and the multiplication will keep growing on. And this will have the brood capsules will have inside the scoliosis. Now this will be always in this larval stage that cannot develop into the fully worm, the tapeworm, that will not convert into the fully grown Echinococcus granulosus because environment is not favorable. Although the liver is providing the nutrition, so that's why they are multiplicating and forming many cysts, granddaughter cyst, daughter cyst, but it will not grow into the young, or it will not mature into the proper worm. Now the symptoms. Mainly many patients are asymptomatic, but in many cases there could be dragging pain in the abdomen, in the right side. So right sided abdominal pain, dragging pain, because that will compress, will put pressure on the liver, so liver will grow, so hepatomegaly, and liver has round borders and smooth surface. Besides this, there will be jaundice because it will compress the biliary tree. So that compression will cause obstructive jaundice. So in many cases it is asymptomatically, and if this Echinococcus granulosus travel into the brain, then it will cause focal epilepsy. If it travel into the brain. If it travel into the liver, it will cause jaundice. If it travel into the kidney, then it will cause hematuria. In skin, it will produce allergic manifestations. In lungs, it will produce congestion and dyspnea, difficulty in the breathing. So, the features are depending on the organ which has got infected. Now, if this hydatid cyst get contaminated or get infected or suppuration occurs, so patient will have the fever, malaise and body ache. So, these features will present if that cyst get contaminated. Now, the investigations. MRI, CT scan, X-ray. In X-ray, the calcified cyst or the speckled calcification can be seen if the cyst get calcified, and if the Echinococcus granulosus has traveled into the bones that will get also identified in the X-ray or CT scan MRI. Then beside this, ELISA test, antibody detection test, then aspiration of the hydatid fluid, then the Scoles examination in the stool and urine and vomit of the patient, then ERCP if there is obstructive jaundice. So ERCP followed by splenectomy will be done. So these are the investigations. Earlier Cassoni intradermal investigation was done. Cassoni intradermal investigation, but because of its low sensitivity, it has now stopped. Now usually it is not done. Then the complications with hydatid cyst can get calcified. It can get rupture in the peritoneal cavity. So if it will get rupture in the peritoneal cavity, then it will cause contamination of the peritoneal wall. Then suppuration can occur, and because it will produce compression over the biliary tree, so jaundice.